Hello, good evening, good afternoon, good morning, good day, wherever you are in the world. Welcome to the Black Belt Academy of Surgical Skills. My name is David O'Regan. I'm a cardiac surgeon in Yorkshire in the United Kingdom. I'm the director of the Faculty of Surgical Trainers for the Royal College of Surgeons of Edinburgh, and I'm a visiting professor at Imperial College London. You might perceive that my voice is rather husky and I'm sounding a bit chesty, because that is indeed I am. I've had a bad cold for the past 3 days and just recovering from it. It is COVID negative, but my son has turned out to be COVID positive and he's feeling lousy too. And I've reflected my years of surgery and operating that I've gone into theatre stoically, operated with a mask on under such conditions, thinking that I'm doing my best. Foolhardy in retrospect, when you think that fighter pilots at Top Gun Miramar are allowed to go to the air squadron leader and say they're not up to flying today, can I take a time out? But we don't seem to do that in surgery. There seems to be a bravado there, which is not useful. With a bad cold, with reduced senses, your appreciation of the environment is curtailed. Now, I asked for feedback on all my lessons, and the feedback from last week's lesson was I was wearing some loops, but the loops were not explained, and I need to explain them this evening. Surgical loops are used to help improve the sense of vision, and these are 3.2 magnification, and you should put them on comfortably, sitting on the nose without a tight band around the head, and the focus should be at the level where your arms are relaxed, elbows are by your side as explained, extended, and your hands palm flexed. And that is the depth and focal distance for my loops, to enable me to stand correctly and maintain my posture. Some loops indeed come with lights, others with cameras, and they'll all add weight to the head. And if you're not standing correctly, that weight will be amplified. As your chin goes forward, you hunch over and will add kilograms to the overall weight of your head, as previously explained. So therefore it's important that you get measured for your loops, for your function and position. We're talking about senses, and the senses of the mind inform the mind. And I'd like to go back to Miyamoto Musashi and the Book of Five Rings. In the science of martial arts, the state of mind should remain the same as normal. In ordinary circumstances, as well as practicing martial arts, let there be no change at all, with the mind open and direct, neither tense nor lax, centering the mind so there's no imbalance. Calmly relax your mind and savor this moment of ease thoroughly, so that the relaxation does not stop its relaxation for even an instant. Even when still, your mind is not still. Even when hurried, your mind is not hurried. The mind is not dragged by the body is not dragged by the mind. Pay attention to the mind and not the body. Let your inner mind be unclouded and open, placing your intellect on a broad plane. And it's essential to polish the intellect and the mind diligently. And it reminded me of the story of Sherlock Holmes. The character of Sherlock Holmes was based on Professor Bell, the professor of surgery at the Royal Edinburgh Infirmary. He was an astute clinician, that used all his senses in the pre-operative, operative and post-operative period. And I commend you all as trainees to use your senses the same. I can walk onto a surgical ward and you can smell Pseudomonas. You can smell Clostridium. I remember on a Friday evening walking onto a ward after being up all night and really wanting to get home, but you never leave the hospital without rounding your patients. And the sister took me to a 74-year-old day 4 post-op patient who was in bed 29 at the end of the ward. And she had an aortic valve replacement. And the sister told me that this patient was feeling nauseous, which is unusual after cardiac surgery because we don't interfere with the gut. And 4 days post-op, she's not on opiates and therefore should not feel nauseous. I went to feel the lady's pulse. I call it the cardiac handshake. Hold her hand and feel her pulse. And as I did that, she burped. I immediately asked sister to get me an NG tube. And I put an NG tube down and 2 litres of feculent vomit came up into the bag almost immediately. That lady was probably a few breaths away for an inhalation, and she probably would have died with that amount of feculent vomit. So use your senses all the time. As trainees, walk around the ward and think to yourself, is that patient well or unwell? What are the clues that are giving you the sense that they're well or unwell? Post-op patient, wearing glasses, reading a book, with lipstick on, with a cup of coffee, is probably doing all right. But beware the quiet, because the quiet often are very ill, even on major trauma scenes. Babies, when they're very ill, are very quiet. And elderly people, when they're very ill, are likewise quiet. And there is a story when a physician was being shown round an elderly patient ward, and somebody commented that the lady in the corner was gaga, and she was going like that and made all this noise all the time. But this physician noted that she had a dislocated jaw and went to her, put the jaw in position, to which she said, "Thank you very much. I've been trying to get somebody's attention for some time." All may not be what it seems, and therefore it's important to use your senses. And think about it this way. At the back of all the textbooks that you have, certainly the Oxford Handbook of Medicine, the back of that was a compilation of syndromes described by clinicians who used their senses to identify particular syndromes based on what they saw, what they heard, and what they felt. Hardly any of them are described on what was on CT scan, MRI scan, or blood test. These were clinical senses informing the clinician. And I remember Jane Somerville at a clinical pathological conference at Brompton interrupting the presenter who's presenting a very rare syndrome. And she said, "It's obviously this syndrome," because she recognized the pattern. And I suppose that pattern is behind Malcolm Gladwell's Blink. I do recommend it for reading. Of course, going into theatre, there are many other clues around. And certainly if the trainee's been operating and I waited outside as they're flying solo for the first time, the sound of the ECG, the sound of the ventilator, the body language of the patients, and I even take note of the smell of the diathermy. If there's lots of smoke in theatre and burning flesh of diathermy, I know they have not been as neat and tidy and methodical in the opening as they ought. But it's also important to realize that as a surgeon, at times of stress, your cognitive functions are curtailed, and your ability to take in and sense all this information is reduced. For those of you who were with me last week will note that I looked out of the light to find my 7-O-proline wearing my loops, and of course I had lost it. I could not see it. That is why you need to, as a surgeon, to depend on all of those around you for their senses of smell, of sight and of hearing to inform you what is going on. These are human factors. It's quite natural to tense up when there's been a mistake. But please do not lose focus. Open your mind to the senses of others around you. There are very few things in surgery that require immediate stop, don't do that, attention, because you can put a hand in it, cover it and call for help. But when the anaesthetist says, please, we've got a problem, you put your instruments down and you pay attention, because a falling cardiac output or decreasing saturation is not tolerated for very long, and it needs attention. I recall as a trainee in neurology, the conversation went as follows. We took a patient to theatre who had an obstructed infected kidney. And for those of you in surgery who understand the problem of an obstructed infected kidney, it is an emergency. So the patient was in theatre and the ureteroscope was up the ureter, and the conversation went as follows. Clifford, we've got a problem. Yes, I've almost got the stone. No, Clifford, we have a problem. Yes, I've almost got the stone. Just give me a moment. Clifford, the patient is in trouble. Yeah, I'll have the stone in just a moment. Clifford, I'm afraid the patient has died. And that is commonplace, because our cognitive ability reduces. Our senses in surgery do rely on your sight, your smell, your hearing, and everything else around you. And being a good surgeon is to be able to take that all in, but also recognize when they are curtailed, you invite opinion and allow opinion and options. They train this in British Airways pilots and all flying pilots. When in problems, ask open questions, keep your mind open, as said in martial arts. I think I've got a problem this evening, as my camera, yes, it is working. I had a feeling that was on the other camera. This is the fun of being live. So in surgery, what we've talked about in our posture and our stand and use of our hands is to maximize the prehension that we are blessed with, the ability to bring palp of thumb and palp of fingers together. And this is where we get the feel and sensation of the instruments. So I'd like to go through all the instruments one by one and highlight how we hold and how we feel the instrument and the sensation, and offer you models to practice that at home. So we're going to go overhead. Thank you. And look at our 5 instruments. And we'll start off with a needle holder. And the needle holder, as suggested for the rotation, needs to sit between the index finger and middle finger and on a line demarcated between that point and the common flexor origin. It's held lightly in the hand. The ring and the index finger are folded over it. My index finger is extended down the back, and my fingers are gently applied. But the interesting thing is that important that you feel the needle go through the tissue. And as you're familiar with the models that I use, and I'd like you to practice with, is feel the needle go through the skin of a banana, for example, as opposed to going through the flesh of the banana. And you can see and feel that there is a significant difference. And I recall Sam had done a very nice aortic valve replacement, and his closure of the aorta was perfect with metered 4mm by 4mm stitches. And I was delighted with this trainee's success, and it looked beautiful. We were coming off bypass, however, and the aorta itself started to unravel. I could not understand why. I suggested it came round to take over, and I knew immediately what the problem was when I took the stitch through the aorta, because the needle went through the aorta as this needle is just going through the banana. It felt like a needle going through butter. I had no proprioceptive feedback at all of that aortic wall, and immediately diagnosed the problem of cystic medial necrosis and buttressed it with Teflon on either side. How you hold a knife is likewise important. As pointed out, it is held between the thumb, excuse me, thumb, index finger for proprioception direction, and I'm holding it between the side of my finger and my thumb with the palm of my finger extended down. This is enabling me to keep the blade perpendicular at all times without it slicing. But can you feel the difference between taking your blade through an orange and not going through the flesh underneath, as identified by holding it up and squeezing it to see if any juice comes out? And can you feel the difference using your knife and taking it gently through the skin of a tomato and practicing that? Literally, the weight of the blade is enough to cut through, and sensation. The sensation will only be there if you're holding it in the tip of your fingers. Likewise, the scissors. The scissors, like all instruments that have rings, are best held not by sticking your finger through the ring, especially beyond the distal interphalangeal joint. They're best balanced on the palp of the fingers. For those of you with small hands, you'll need to bring your fingers in more obliquely, such you maximize the palp of your finger touching the instrument. I put my scissors on my thumb, my ring finger, my middle finger sits on the scissors with my index finger extended down. Again, lightness of touch, holding that. And the feel comes from practicing cutting tissues, and I do love the sausage for this, is finding tissue planes and feeling your scissors. Can you get the skin off the sausage? Literally feeling your way through. Again, it is lightness of touch. From a knife point of view, I recall doing a patient with hepatitis C, and I needed radial artery. Amit said, I'll take the radial artery. Then he put double gloves on. And I suggested that he didn't, because you'd lose the feel of the instrument. Lo and behold, what happened next is the knife went straight through the radial artery, and we had infected hepatitis C blood spreading all over theatre because we'd lost the feel. And I like this model for the scissors. You again feeling the tissues, and you can only feel it and get the sensation by holding the tissues lightly. Also, using your scissors as blunt dissection is teasing off the layer without stabbing the sausage meat underneath. Personally, when I get to these models, I find myself being immersed and enjoying the sensation of operating. Because when you separate planes like this, you've got to admit, it gives you a very good feel. And that's what surgery is all about. Coming on to your forceps and how to hold forceps, remember that the forceps themselves can do damage. And unless you hold the forceps properly by extending the distal interphalangeal joints and allowing the palps of your fingers to feel the instrument, you will be applying excess tissue, excess force on the tissues. And if I take this banana and simply squeeze the edge with a pincer grip, as for holding a pen, and you can see my fingernail blanching, that is generating about 30 newtons of pressure. The tooth forceps will be even worse and leave marks. Pounds per square inch, that ends up at about 1,800 pounds per square inch, or 6 million newtons per meter. Just imagine the damage because you're not sensing and feeling the tissue. The same applies when tying knots. And knot tying is all in the feel between your fingers and thumb and feeling the tissues being brought together and getting the sensation of tissues being ligated. And the feel comes by putting your finger on the knot. You probably can't see this thread because it is at 6/0. And there you have it. So all surgical instruments, whether a Leahy, a Halstead, a Castro's, require respect and use the palp of your fingers to hold. For left-handers, hold it in the palp of your finger, take it on, take it off, put it on. Take it off, put it on. The thing to also recognize ratchets, don't put the ratchet on any more necessary than to do the job. And this is particularly true for aortic tissues or other tissues, because the amount of force being generated by your hemostats is huge. Leahy, again, similarly held like your scissors. With the tips of the fingers, and on the left non-dominant hand, tips of the fingers taking it on and off. In fact, the gentlest things you can use as instruments in surgery are the tips of your fingers. Certainly, to hold the vein or conduit for bypass is best held with the tips of your fingers, rather than a hard, rude instrument. Putting in a chest drain, to use the tip of your finger to explore the space of the pleural cavity is important. I remember in a trauma patient in my early days putting a finger in and identifying that the stomach and small bowel was sitting in the chest with a chest drain. Likewise, if you'd done a trocar only and an instrument without using your finger, patients who have got inflamed lung are at risk, because the inflamed lung sometimes is solid, inflammatory and friable, and any instrument will go through that. To put a finger in to gently feel around is important to ensure that you've got the space. Although I have put my finger in to remove a pericardial effusion from a subxiphoid incision. And in that circumstance, I found my index finger sitting in the right ventricle. I left it there for hemostasis. The anaesthetist said, "Do you need help?" I said, "Yes." My colleague arrived in theatre and said, "What's the plan?" I said, "Live patient. I'll focus on this. You set up bypass in the groin," which she did, and she took over the running of theatre while I focused on what was in front of me. This is where human factors come in, to realize that under stress, your cognitive function decreases, your sensory functions decreases, and where you need other people come in and you get them to help you. In surgery, that is often your assistant. Remember, they're standing opposite you and looking at things by definition from a different 90-degree angle, which, when you're peering at a small vessel with loops on a 2mm coronary vessel, you can quite imagine, if I'm thinking my stitch looks fine from this direction, it might look totally different, and the outcome could be significantly different as well. So although you might think that your senses are good, remember, under stress, and if you're not well, they're going to be curtailed. Use the other people around you and invite them to use their senses too. The story goes of a gynecologist doing a hysterectomy, and apparently the trainee in theatre broke wind. The gynecologist took a sniff and said, "Sister, I think I've hit the bowel," and proceeded to look for the hole he made in the bowel. Sadly, apparently, the trainee did not confess to breaking wind. So it does work both ways, of course. Thank you very much indeed for joining the Black Belt Academy of Surgical Skills. Remember that you can practice at home. What I did this evening was raided the fridge and used all your basic instruments to feel different tissues, remembering that the instrument is just an extension of your fingers, and it's only by holding the instruments lightly and at the tips of your fingers will you get an appreciation of the feel and sensation of surgery. Thank you for joining the Black Belt Academy of Surgical Skills. Thank you to the 3,083 followers. I would like to see pictures of your practice and what you've found at home to help you feel the tissues. Keep them coming in. I'll see you next week. Be safe and be well. Thank you.